As we get older, it's inevitable that maintaining our health will become increasingly important. Eyesight is a key concern as we reach retirement age, one that can have a huge impact on our quality of life. Mr. Bobby Qureshi from the London Eye Hospital explains why eye health is so crucial, especially as we grow older.
The eye is a sensory organ responsible for vision. It translates the world around us into electrical signals that the brain can perceive as sight. Essentially, it's a sphere, about 22-23 millimeters in diameter. The white part of the eye is called the sclera, but it's got a transparent area at the front, which is called the cornea. This is actually responsible for quite a lot of focusing power of the eye. And the light comes through this transparent window. It goes through an aperture, which we call the pupil. And people have brown eyes or blue eyes, which it composes the iris, which in the center of which is the pupil, much like you would have an aperture in a camera. And then you have another lens behind this, which is responsible for the finer focusing to make sure the light is actually striking the retina in focus. The retina is composed of many different layers of cells and lots of nerves, which then translate this focus light into electrical signals, which go down a bundle of nerves to the brain, and we see effectively. The eye contains a lens, which when we are young is flexible, so it can change its shape and become fatter or thinner. Well, as we get older, the lens becomes less flexible and more rigid. So even though the muscle is working, trying to change the shape of the lens simply can't respond. And this happens in our 40s, and we call it presbyopia. So the eye is no longer able to change its focus, for example, to bring the focus closer to us to read. And we all find we need reading glasses. And this is a natural thing to happen. It's going to happen to everybody at some stage in our life, usually in our 40s and 50s. As the lens ages further, it starts developing opacities within the eye. And at that stage, we call it a cataract. Now, to start with, people may just notice they need to change their glasses more frequently, or they're getting a little bit of glare, but these are all symptoms that a cataract may be developing. As a cataract develops further, the vision will become reduced. And despite the best pair of glasses, you will not be able to achieve the potential vision that you can. And at this stage, the only way to treat the cataract is to remove this lens, which has become hardened and opacified, and replace it with an artificial one. And we would call this cataract surgery, together with a lens implant.
My glasses have just been changing, a bit over the years. That it's always been the first thing I do in the morning is put on glasses, and the last thing I take off at night is my glasses, really. I've been having annual eye tests for the last 7 or 8 years, and I had a scan. My optician did a scan last year and said I had the beginnings of a cataract. This year he said, oh yes, you've definitely got a cataract. And I had new lenses in my glasses, and I have every year for quite a long time. It just got to the point where I thought I had to stop riding my motorbike. I was going to go to the Nürburgring with some friends on my motorbike, as we've done before. But I could tell that it wasn't going to work because I couldn't see well enough to be, trust myself to stay out of trouble, really. So that's when I started looking at the options of dealing with the cataract, because my glasses were costing, just the lenses were costing, by this year, about £350 just for the lenses because of the prescription. So it was at that point that I thought I really do need to start looking for options here, because I'm 61, I don't know how much longer of active life I've got, and I really need to look at what action I might be able to take.
The way of carrying out cataract surgery has evolved over time. In terms of going back through history, there used to be a process called couching, where you used to just press on the eye with your finger and you would push the cataract out of the way to fall into the back of the eye. And this was practiced for 1,000 years, really. The first mention of a cataract actually being taken out of the eye is probably in medieval Islam, where they used to have a fine tube which was inserted into the eye, and the physician would suck on the tube to actually suck the cataract out of the eye. And we can only imagine what kind of trauma that actually caused to the inside of the eye as well. These days, obviously, it's done completely differently. Even 20 years ago, however, we were removing the cataract in one single piece. So you would make a large incision into the eye, often 8 to 10 millimeters, and you would remove the cataract in one piece, put an implant in and put in 5 stitches. This again took quite a long time to heal. The eye was never as strong as it had been before, and there were many risks and complications associated with it. After that, a technique was devised, and we've only been using it really for the last 25 years or so, where we could break the cataract up into small pieces within the eye, thereby removing it through a smaller incision. And this technique is called phacoemulsification, and it utilises ultrasound, which is a needle vibrating inside the eye many thousand times a second, breaking up the cataract, and then the cataract is sucked out of the eye.
I suppose I had enough concern and fear about what options were available to pause and think about what would be the sensible options, really. My first option would have been obviously NHS for the cataract. I looked into that. There was a long waiting list even after referral, you know, actually seeing someone for the first time. And also the replacement lenses were just one distance. So because I've always worn glasses, at least I've only had to worry about one pair of glasses. I thought it would be just awful to be able to see at one distance and have to have several pairs of glasses. So and that felt a bit unmanageable, really. And also, because I had a cataract in one eye, I would have had to have waited into the future to find out what the options might be for the other eye. So I started looking at the private options, heard about Mr. Qureshi, and it seemed to be, from the research that I did, that he had the widest range of options. So I decided that it was at least worth having a consultation and seeing what those options were, because I wanted something that would allow me to ride my motorbike, to drive, to do outdoor things, to continue playing a bit of sport as far as I'm able. I cycle a lot, and that seemed to be a possibility.
Traditionally, cataract surgery involves making a small incision, about 2.5 millimetres these days. It's performed with a blade. We then create an opening into the cataract, which again is performed with a needle or a pair of forceps, which is a circular opening, roughly about 5 millimetres in diameter. This then gives access to the cataract inside, which is surrounded by this membrane, which we call the capsule. The cataract is then broken up with ultrasound, which is a needle vibrating many thousand times a second, and then sucked out of the eye. A lens is then injected into the eye usually, or previously used to be folded and placed in the eye, and it opens up in exactly the same position as your natural lens.
Before the surgery, I started sort of wondering, is this the right option? Am I doing the sensible thing? And as it got closer, I decided that actually I'd weighed up all of the pros and cons. I'd done as much research as I could possibly do. I decided that it looked into it further, decided that was absolutely, I wanted to go ahead, and then I became really excited and couldn't wait to begin, actually.
Last year, cataract surgery took a huge leap forward again, and now we can use lasers to carry out many of the steps of cataract surgery. A scanner makes a three-dimensional picture of the eye up to close to a micron level of accuracy. The computer then analyzes this image and programs the surgery accordingly. The laser then will make the incision into the eye. It will create the opening into the cataract, all of which would previously have been carried out with needles or knives, and it will break up the cataract into smaller pieces. And it does this at micron levels of accuracy, and that part of the procedure often takes no more than 30 seconds. This is a huge leap forward because it increases the safety eventually to the patient. The incision can be crafted in 3 dimensions, so it seals far better after the operation, potentially reducing the risk of infection. The opening into the cataract is always perfectly round and perfectly centered, which is very important, and the chance of tearing the capsule is minimized. Also, when we are breaking up the cataract using the needle, there's a chance the needle will catch the membrane and the membrane will tear, and this can often happen in 2 to 5% of cases using traditional surgery. With the laser, this is in 1 in 5,000 or less from the statistics that we have. All this means that surgery is safer and much lower amounts of energy are consumed to break up the cataract inside the eye, and we can remove it through a far smaller incision. Indeed, some of the implants we put in the eye, the operation can be performed just over 1.5 millimetres, and the healing times are half what they would be for traditional cataract surgery.
First of all, I look after the patients when they come in. I do a pre-op phone call to get to know them a little bit and I know about their medical background, and then they come into me here on the day of operation. A patient will have a consultation with Mr. Qureshi. He will then diagnose what sort of lens would be good for them, and then if they proceed, then they get booked in for theatre. I suppose it's their eyesight at the end of the day. They're nervous about what the outcome will be afterwards, but the only thing you can do is just reassure them. The patient will arrive here at the time that they're given. They will then come into this room here with me. I will admit them and then explain that I will be putting eye drops into their eye, the one to be operated on. It dilates the pupil and also it's a local anaesthetic.
Mrs. Owen, she's developed cataracts gradually over time, and she's also a little bit short-sighted. So she's going to have cataract surgery, and she's going to have a special type of implant which will allow her to have good reading vision as well as good distance driving vision without any glasses at all. And she's chosen to have the procedure using laser surgery, so there shan't be any needles or knives for carrying out the operation, and the laser will perform most of the operation without using any needles or knives, essentially. If you don't have the operation, the cataract will gradually just get worse, and that means the vision will deteriorate, and despite the most up-to-date glasses, your vision will still continue to get worse. At some point you will have to have surgery to remove that cataract from the eye. So when you have the surgery, it's really an individual choice, and some people may choose to wait until their vision is really quite poor. But these days, as soon as the cataract is symptomatic, or it might be just causing them glare so they can't drive anymore, or the vision has actually reached a level where they can't do all their daily activities, we would remove that cataract and replace it with an implant. For some people, it just means they don't need to wear thick glasses or contact lenses afterwards, but for the vast majority of people, removing the cataract will give a significant improvement in their vision. And you can combine this with a special implant so you can reduce their dependency on glasses. So effectively they can read, work on the computer, drive, all without glasses, and this really should stay there for the rest of their lives. The laser is now creating an opening into the lens or the cataract. Then it's going to break up the cataract into 4 pieces. It's doing that there, and then it will actually make our incisions for us as well. All without any needles or knives. That's most of the steps for the operation already done. It all went very well, no problems at all. You okay there? Good.
Leading experts and healthcare professionals strongly recommend having regular eye tests and checkups for cataracts, glaucoma, macular disease and a range of eye conditions. It's vital for catching any problems before they cause serious damage to your vision.
London Eye Hospital is one of the UK's leading private eye hospitals, utilising the latest technology for surgery carried out by the most experienced and pioneering surgeons. Our mission is to simply provide the highest level of eye care without compromise for the diagnosis and treatment of all eye conditions. You can check out our pioneering treatments and products by visiting our website, londoneyehospital.com.
One Doctor gives you national prefixed prices with no call-out or overtime charges 24 hours, 365 days a year. Drain Doctor. Emergency plumbing and drainage. As quick as a wink. The Doctor will see you now.
Welcome to the 50 Plus Show, the largest exhibition for the active 50 Plus in the UK. The 50 Plus Show takes place in Manchester in March, in London in July and in Glasgow in November. There's lots to see and do at the 50 Plus Show, and best of all, the 50 Plus Show is free. Google the 50 Plus Show to find us. We look forward to seeing you at the 50 Plus Show.
Choosing a plumber should never be a gamble. Call Drain Doctor and it won't be.
Creative Dental Clinic in Budapest, Hungary, the leading destination for dental tourism in Europe. Specialising in dental implants, oral surgery and porcelain crowns. We have provided affordable dental care to UK patients for over a decade at prices 50% to 70% cheaper than in the UK. Make the right choice for dental treatment abroad. Contact our UK office or visit our website to find out more. Creative Dental Clinic. Start smiling today.
There's a national plumber that charges you the same rate with no call-out cost, day or night. Drain Doctor.
London Eye Hospital is one of the UK's leading private eye hospitals, utilising the latest technology for surgery carried out by the most experienced and pioneering surgeons. Our mission is to simply provide the highest level of eye care without compromise for the diagnosis and treatment of all eye conditions. You can check out our pioneering treatments and products by visiting our website, londoneyehospital.com.
During recent years, the technology and treatment options in eye care have dramatically improved, with clinics and ophthalmic surgeons achieving remarkable results in the treatment of many common eye complaints.
So we don't need to use any needles or blades because the laser's made the incision. All I have to do is open them up with a spatula. This is a typical lens we would put in. So it's contained within this cartridge. So the beauty about these lenses is they don't touch anything from the time that they're packaged sterile until they actually go into the eye. Whereas before you would have to touch them with the forceps and fold them and put them in the injector. These come already pre-prepared, so nobody needs to touch that lens. So it's perfectly centered in the eye. It looks very nice. That's great. That's it, all done. A couple of fine antibiotic injections and we're finished. All done.
I couldn't feel anything. It was painless. Just sort of shimmering lights, the circle of lights that I was looking at. This all seemed to go together and just shimmer. But it wasn't uncomfortable.
So this stays on until tomorrow morning. And off with the patch, start putting the drops in. Just very careful when you dab the eye, you don't put any pressure on it. I think everybody over the age of 40 really should visit an optometrist to have their eye checked regularly. The optometrists do a range of tests, not just checking their vision, but also having a look at their eye, measuring the pressure inside the eye, and having a look at the retina as well. From these you can tell if there's not just any problems in the eye, but sometimes an eye is an indicator of problems with the rest of your body. So for example, in many cases diabetes is diagnosed without the patient being completely aware of it from just optometrists looking at the eye. If you've got a family member who has glaucoma, you have an increased risk of having glaucoma as well. So we also recommend if you're over the age of 40 and you've got somebody in your family who has glaucoma to have your eye checked regularly. Also, most people do end up going to the opticians anyway round about this age because they start needing glasses for reading. And at that stage they can be prescribed the appropriate glasses for the work they need to do. And later on you can also see if they're developing cataracts and make sure they have surgery at the appropriate time.
About 2 years ago, 2.5 years ago, I began to get trouble with my eyes, and I went for an examination and I was told I had the beginnings of cataracts, but they weren't ready to be, or they weren't what they called ripe for operating on. This went on and I gradually got worse, or my eyes got worse, and I was changing my prescription quite regularly. So I booked an appointment. I met Mr. Qureshi and was very impressed with him. He gave me full assurance of what my problem was and what he thought would be best for me.
Martin came to see us because he was developing early cataracts. He really had quite poor vision when we saw him. It was nearly at the top of the reading chart, and he's a tennis coach and he was finding it increasingly difficult to judge distance and was wearing short vision glasses and distance vision glasses to carry out all his daily activities. As well as removing his cataracts in the safest way possible, he also wanted to be more independent from his glasses. And to that end, he chose one of the implants which enables him to have good near vision and good distance vision. For him, intermediate vision was also quite important, so we opted for a trifocal type of lens, which gave him the ability to read close up without glasses, also to use his computer for intermediate, or in his case, continue his tennis coaching.
So he told me about it, and it sounded perfect for me because I was playing tennis and I was having problems playing tennis because of the cataracts. And I thought, this sounds good, and he confirmed this would be best. So I said, okay, let's go ahead. I'm quite happy with what you told me. I'm very pleased, and can you do it as quickly as possible? Within a week, I had my first eye done. My feelings before the operation were like most things I've had to face in life, whether it was going out to bat at cricket or going for an interview or an examination, was to say, forget it, put it out of your mind, just get on with it. And within 20 minutes I was out. I had no pain, I had nothing at all. Absolutely just a peaceful transition from one room to another. I came out and had a patch on my eye. I was given some instructions, fairly detailed instructions regarding putting drops in your eye, which you have to do for 6 weeks. And there are 3 different drops. So I said, okay. I went home, I went to bed, and I put a cover over my eye, which they give you to sleep, so you don't touch the eye or harm it at all. And woke up in the morning, and that was when my first feeling of anything was the excitement of tearing off this patch on my eye. And in my bedroom, I have in the far corner where I put my tennis rackets. And before I had the operation, I used to wake up in the morning, look across and see if I could see the names on the rackets. They would just be fairly blurry. I woke up, I took the patch off, and I could see. And that was the most exciting thing for me for years.
He had a fantastic result, and as you saw him earlier today, his vision is 20/20 now for distance, and the same for reading. And it's N6 to N8 for intermediate, which again is superb intermediate vision.
2 weeks after my first operation, I had my second eye done. It seemed even quicker. My son picked me up, took me for a coffee, and I wish I'd have done this a long time ago. And that shows it was that quick, the change in difference from having cataracts to having a new lens.
There are many factors involved in general eye health. UV light is quite important, and over the course of a lifetime. It has an impact on cataract progression and things like that.
When I played professional cricket, I used to coach in South Africa in the winter months. I went to Australia and coached there and played cricket there. I never wore a cap, and people used to say, well, you should wear sunglasses and a cap in the sun. I never did. So I was either lucky, lasting until my 70s before cataracts arrived, because I never wore sunglasses either. I do now. I didn't even, never entered my mind.
People can take vitamin supplements to just preserve their retina and keep it in better health. Some of these are also present in various food substances, so big green leafy vegetables and things like that. Smoking has harmful effects for the rest of the body, and similarly it is not very good for the eye either.
I'm retired, so income is flat, and actually for me not that great. So by the time I'd worked out what I'd paid over the years for glasses, there was that. And also that concern, okay, I've got a cataract. It's getting in the way of my being able to do the things I want to do. You know, motorcycling, I've been a motorcyclist since I passed my test when I was 19. And apart from, I think it was a 2 or 3 month break, I've always had 1 or 2 motorbikes. I mean, that's still something that I want to be able to do. I'm cycle with friends, you know, and that's a delight, getting out into the countryside and, you know, on muddy trails. I want to, you know, be a bit silly still and be able to do those things with friends who are a bit younger and can still do it. You know, I ran for years. I can't do that anymore because of, you know, various other bits of injuries, and But there are many things that I can still do, and I'm really looking forward to going swimming in the sea, because today is the first day that I'm allowed to. I don't think I will today, because it's a bit away from here, but in the next few days I should be out there in the sea and be able to see. That's going to be quite special.
These days people are ever increasingly sitting in front of their computers, and again people can get eye strain from looking at their computer screens. So we advise people to just take a break from time to time. And people who've got dry eyes, for example, when we concentrate, we don't blink so often. So you might find your eyes are getting uncomfortable, especially contact lens wearers. I have osteoarthritis in my knees from my cricket and soccer football days. It's in my hips now, and it's from playing tennis on hard courts. And I've been told that I may need a replacement knee. Replacement eyes or replacement lenses are far more important. They can chop my leg off. I'd rather have two good eyes. Not that I want to lose it, but I'd rather have two good eyes. So if you're asking me, yes, that would be my number one, eyesight. Definitely. Increasingly these days, because cataract surgery is so safe, people are opting to have surgery so they can correct their presbyopia. And at the same time, it will remove the need for cataract surgery in the future as well. The importance of eye care as we get older is very important. Most of the diseases we've already mentioned happen as we get older. They're not diseases of young people. Everybody in the world is going to develop presbyopia and cataracts if you live to be old enough. Glaucoma also will affect a very large number of people, as will macular degeneration. And many of these things, if they're caught early, the treatments can preserve much more vision than if you find out much later on once the vision has already been lost. Have regular checkups with your opticians so they can diagnose cataracts or glaucoma or diabetes or macular degeneration at an early stage. There are also some things that people can do to look after their eyes in general. So a healthy diet, stopping smoking, taking the vitamin supplement if you have signs of early macular degeneration, are all helpful in preserving our sight in the long term.
Advancing age can bring with it the increased possibility of deteriorating vision, but retirement should be an enjoyable and exciting time. Regular checkups and vigilant eye care routines should be top of the list to ensure our eyes stay as healthy as possible for as long as possible.